So hello everyone, my name is Sarah Dukmasian. I am the Adirondack Rural Health Network Manager for AHI. I'm also the new program lead for the telehealth program that AHI holds, North Country Telehealth Partnership with Fort Drum Regional Health Planning Organization. So with that being said, I'm going to kick off this first meeting. We have two telehealth policy updates. Casey DeBellis and Wanda Pamphile. I have it in order on the agenda. So Casey, if you want to kick off first, I will unmute you just to give brief updates. This will all be in the notes as well. Casey, you're good.
Can you hear me?
Yes.
Okay, great. This is Casey DeBellis. I work at the New York State Department of Health for the Medicaid program on Medicaid's telehealth policy. Thanks for inviting me today. I just have a few updates for you all. So just this morning, actually, we published the most recent version of our telehealth policy manual. So you can access that on the department's telehealth webpage. And if you're subscribed to the Medicaid Update newsletter, it also will be announced there. So I recommend checking that out. And there's a change log at the very end of the document that outlines what the most recent changes are. And regarding the Rural Health Transformation Program, you may have seen that CMS announced the awards. New York's application did include some telehealth initiatives, including expanding e-consults. So right now we're adjusting the original budget submission to match that award amount, and it needs to be resubmitted to CMS. So we don't have a lot that we can share in terms of what implementation will look like quite yet, but we'll do our best to keep folks updated as we have more information. And my last update is just a reminder that Medicare's telehealth waiver do expire January 30th. There's a rumor that it's going to be extended. Unfortunately, I really don't have more information. We certainly hope that it gets extended, but stay tuned for updates coming from the federal level. So just a reminder that New York State Medicaid's policy is distinct from Medicare, but members who are duly enrolled in Medicare and Medicaid are still subject to Medicare's rules. So stay tuned. We hope to get more information soon as that deadline very quickly approaches. And as always, please feel free to reach out to us. I don't remember if I included our mailbox to Sarah in my notes, but I can drop it in the chat and folks are welcome to reach out to us if there are ever any questions. But that's it.
I don't know if you did either, but can you please put that in the chat? I'll add it to the notes as well.
Absolutely. Thank you, everyone.
Thank you so much. All right, and then Wanda, give me 1 second to just unmute you. Everything's going a little slow today. I think the snow is knocking us all down. All right. See if that worked, Wanda.
Okay, good afternoon. Can you hear me?
Yes.
Perfect. Okay, thank you so much for the invitation. And I'm glad that Casey was able to lead with that because I will touch on the rural health transformation a bit as well. But first, I did want to state that, as many of you know, the government is currently operating under a continuing resolution that is set to expire at midnight on Friday, January 30th. So if the resolution expires without extension, the government will enter a partial shutdown, which would include HHS, along with several other agencies. So next, again, I wanted to touch on the rural health transformation. We know that CMS is investing in rural health and recently announced $50 billion in awards to strengthen rural health across all 50 states. And we were thrilled to hear that New York received more than $212 million. There are a few key updates I'd like to share. Funding begins in 2026 and will be distributed over a 5-year period. States will use these funds to expand access to care, strengthen the rural health workforce, and modernize facilities and technology. Investments will support a broad range of services, including primary care, maternal health, behavioral health, emergency services, and telehealth. And then, of course, CMS will partner closely with states to support implementation and track progress over time. I also wanted to note that CMS has established the Office of Rural Health Transformation, or ORHT, within the Center for Medicaid and CHIP Services And this new office underscores CMS's long-term commitment to rural communities. And then finally, on this topic, I'm pleased to share that someone who is very familiar with New York and many of our partners will be joining the CMS team to work on the rural health transformation within our office, and we'll have more to share on that in the next couple of weeks. So switching gears a bit, and Casey touched on this a little bit, it's on opioids and telehealth. The U.S. Drug Enforcement Administration, in partnership with the Department of Health and Human Services, has issued a fourth temporary extension of the COVID-19 telemedicine flexibilities for the prescription of controlled medications, extending the current telemedicine flexibilities through December 31st of 2026. Next, I wanted to touch on CMMI models. So the CMS Innovation Center, or CMMI, meaning the Center for Medicare and Medicaid Innovation, they have a strong pipeline of models in development and implementation. These include initiatives focused on advanced primary care, accountable care organizations, specialty care, and episode-based payment and population-based models that serve high need and underserved communities. Together, these models are designed to test scalable approaches that improve quality, promote care coordination, and reduce unnecessary spending across Medicare, Medicaid, and CHIP. I can put a link in the chat at the end of my presentation, just so that you have the access. Like I said, there's a number of models that are already in implementation, a couple of them not necessarily in New York, but there are a few of them that are in the pipeline that will certainly impact New York residents and patients, etc. So look for that. CMS is also working actively to crush fraud, and we are taking a proactive, coordinated approach to combating fraud, waste, and abuse across federal healthcare programs. And this work is focused on protecting beneficiaries, preserving the Medicare Trust Fund, and ensuring that dollars that are spent are medically necessary and also provide high quality care. So we have prevention, and we're doing this through data analysis, and we're making sure that our efforts are reinforced through strong federal partnerships. We are actively working with the Health and Human Services Office of Inspector General, as well as the Department of Justice and other law enforcement, to ensure investigations that are surrounding a fraud are moving quickly and enforcement actions have real consequences. So I'll be sure to put a link in the chat where you can find some resources that may be helpful to you and your partners in helping us combat fraud. Finally, I want to flag an upcoming CMS event. The CMS Quality Conference will take place on March 16th through the 18th in Baltimore, Maryland. This is a hybrid event, so if you're unable to attend in person, you can still participate virtually and gain significant value from the sessions. The Quality Conference brings together a collaborative community of leaders, providers, researchers, advocates, and partners who are all focused on improving healthcare quality and outcomes nationwide. The registration is open now, and the full agenda is available on the conference website. And I'll also put that link in the chat. That concludes my updates. Sarah, I'll turn it over to you.
Thank you. I will take all of those links from the chat and add them to the notes. And if you don't mind, can you also just provide me some of that in an email so I can make sure I have everything? I can only write so fast. My hands get slower in the cold. So
You got it.
perfect. Thank you so much. I think that concludes our updates, telehealth policy updates that we have. There were no updates or changes for OASAS, OMH telehealth regulations, or standards of care at this time. So with that, I'm going to turn it over to Laura Morris and Karen Ashline. They're going to do a presentation on the ConnectAll grant overview for the North Country. So Laura, you should be able to share. If I need to do anything on my end, let me know. And if not, I'm going to hop off video to give a little more energy your way because my screen is going quite slow and I don't trust it.
All right, let me just move these screens around so I'm sharing the right one. All right, is everyone seeing?
There we go.
Okay. Oh, all right. Now I gotta make you all big again somehow. Oh, all right. I'll figure that out
All
later.
right, now I see it.
All right, Karen, you're gonna kick off, I
I'm going to
think.
kick it off. Yes, yes. So good afternoon, everyone. Thank you so much. It certainly is winter in the North Country. I think Mother Nature's on a vengeance this year, but I'm Karen Ashline, Chief Executive Officer for the Adirondack Health Institute and also the Adirondacks Accountable Care Organization. Laura's going to share more of the details, but at a very high level, we've been very fortunate in the North Country to lead some work with our partners at FDR HPO, expanding digital equity across the region. Can you all still hear me? Because we lost the slides.
Oh, okay. Sorry.
There's just
That's
a
okay.
couple of
There.
them.
How's that?
There
I
you
There
was
you
go.
go.
trying to find you and
There you
like
go.
anyway.
Yep. All good. All good. So in 2025, we had a technical assistance grant and we were awarded late in 2025 to continue this work with a capacity building grant. Actually runs for 18 months. We were one of, I think, 12 or 13 awards in the state. So again, very happy that we're able to do this work in the North Country, and we really think it's going to make a difference long term in connecting people to the resources they need, and a very strong partnership again with FDR HPO. So I'm going to let Laura go into the details and talk about what we did in 25 and what we plan to do in 26 and beyond. Thanks, Laura.
Great, thanks. So as Karen mentioned, we started with the technical assistance grant that was basically calendar year of 25. And we had 3 grant defined milestones that I'm going to just talk about in a minute. As Karen said, we've been partnering with Fort Drum Regional Planning Health Organization um, to implement both this technical assistance grant, which was kind of building the foundations, and we're continuing to work with them in the new capacity building grant. This is the coverage area, and you can see how we, kind of why it makes a lot of sense for AHI and FDR HPO to work together. It's a very big region, as we all know, and AHI and FDR HPO have strengths kind of in the different parts of the region. So let's see. So for the TA grant, this was milestone number 1, which was related to strategy and planning. And so the first part of that was to establish a formal coalition structure. So as part of this, we established the North Country Digital Inclusion Coalition, and we formed a governing steering committee related to that. And you can see on number C, we also have formalized coalition governance through that steering committee through written bylaws. And the other part of that was to identify coalition leaders to represent each of these populations that you see. You can see who those individuals were. Those kind of population sector leaders, that is basically our steering committee, in addition with AHI and FDR HPO representation. So sort of starting with a core group, and you'll see when we get to the 26 deliverables, the goal is really to start expanding the coalition out from beyond that core group and really start bringing in, community partners into this process. But we had to start somewhere. Oh, forgot about that little thing. So then milestone 2 was data collection. So what this looked like, the goal was to develop a strategy to inform outreach. So how we did that, a year is not a lot of time, as everybody knows. So we released a digital equity survey, and if any of you attended the AHI's leadership summit, or or kind of connected out there in different ways, we really tried to get this out into the region. We got almost 30 responses from organizations in the region, and what we did for letter C was use that to drive a strategy session with our steering committee. So we convened them, and with the help of a consultant, we have strategy consultant, and really work through the results to determine what the priorities of the steering committee, kind of identify those priorities for the coalition, with the hope that we were going to get that 26 funding. At this point, we didn't know that yet. So that, basically collecting data to develop strategy. The other piece of this was a communication plan. So that in 25 looked like a creation of a website, which I'll kind of give you the web address in a minute, and also coalition kind of branded materials, including this PowerPoint. Trying to use it as much as possible. We're also, as we came to the end of the year and we got the strategy session, we learned that we were, we're going to be granted the 26 grant. We are now kind of the next step of that, kind of a transitional step, is to develop a formal communication plan. FDR HPO is going to be the lead on this to really figure out how to do that outreach piece, how to advertise the various services that we're gonna, and supports and resources that are gonna be out there as part of the 26 grant. So more to come on the communication plan, but as far as this grant done, we got those deliverables. And then the last milestone was this capacity building. So, we didn't get, into the point where we're really like recruiting new members of the network, but that'll be for the new grant. But we did do what's called a collective impact training. And that's really where we took those priorities that were identified from that regional survey, from that strategy session we did with the steering committee. And we worked with another consultant who has a lot of experience facilitating these sorts of things, and developed really a full strategic plan coming out of this. So we looked at, they helped us look further at the survey. They helped us think about the priorities, and they put together a very comprehensive, immediate, short-term, longer-term, kind of priority framework for us to work with. So that was really poising us. By the time we got to that point, we were anticipating that, we had kind of heard that the capacity building grant was going to be coming our way. And so this was really, is going to be the foundation, kind of that jumping off point to move into the next grant. So that was the TA grant. Karen, did you have anything to add to any of that?
No, you covered it well. Thanks.
So we did a survey. I just wanted to give kind of the high level, just so that you could see, what we were hearing, kind of how we synthesized it. So I don't think there's any great big surprises in here for anyone, but you can see residents seem to have a general lack of confidence with more complex technology activities. A lot of people can maybe check their email, but beyond that, it's a challenge to do something with a device. Device access, it's just both, having a laptop or a tablet or even a phone, as well as having, a router and a modem and things like that. Of course, affordability, no surprise there. And reliability. This this big storm we just had is sort of a good example. You have a little bit of ice, a little bit of snow, you lose some power, and suddenly you're not connected to the internet. If you don't have, I guess maybe a lot of people still have their landlines in rural areas, but it's really disconnection, and you can't work from home when every time it snows you're losing broadband. So a thing that came up, and again, I don't think it's a big surprise, but I think it's something that we're going to try and fold into the new grant, is this idea of limited staff capacity to provide support. So we have all of these, community-based organizations, nonprofits, you're out there, you're doing great work, you're trying to connect people, but not all of your staff has the time or the knowledge base to help somebody reset their modem or explain something maybe a little more technical on their Chromebook or their phone. And that was kind of something that came up. And so, like I said, I think we're going to try and fold some of that training, kind of train the trainer into the new grant. Awareness of what programs are out there to help people with their knowledge and, their access and affordability. Not, I feel like this is true across, no matter what the topic is. Like you don't know what you don't know. There maybe, you met somebody at a conference and their organization's provided, but there might be somebody down the road who's providing services as well that you don't know about. There's just not, kind of a big resource out there. There's not necessarily a lot of connection going on that's formal. So that was something that really came up. And as well as you can see here, populations with the greatest need. It's everybody has need in our region. So that wasn't too surprising. This is the website that I mentioned. These slides will be available through Sarah. You can go there. This is based out, as you can see, the FDR HPO. They're obviously the ones supporting it. And we have been, even since we kind of made this slide, been adding some links to free trainings and information that is available through partners or places that we found. So we're trying to expand this. We're trying to make it useful both for the general public as well as partners and organizations working in this space. So more to come on that, but go check it out. Give us feedback if you have any. All right, so that brings us to the 2026 capacity building grant. This is going to be an 18-month grant. It doesn't start until all the paperwork is signed off on, and that, as everybody knows, when there's bureaucracy involved, there's always a little bit of a delay. So it's certainly, we're not the only ones that, are working with Empire State Development to get the paperwork signed, but it's underway. And as soon as that paperwork gets executed, that is the start date of the grant. So it's not like a HRSA grant where they tell you, 2 weeks after the grant period started, congratulations, you won this grant. Sort of like, congratulations, you're going to have, we're going to eventually give you this money, but not, you'll have 18 months from when we kind of agree to terms. We hope that that'll be in the next few weeks, obviously. There's going to be 4 grant defined milestones. As I said, it's building on that foundation of that 2025 grant. And I'm going to walk through those milestones in just a minute. And it's the same coverage area and the same partnership with FDR HPO to make sure that we're really getting this area effectively. All right, so the first milestone is kind of much more of an operational one, which is we need to onboard staff and kind of activate resources. So we are going to hire 2 digital navigators, one for AHI and one at FDR HPO. And these digital navigators are going to be responsible really for a lot of the work and these other milestones. There's going to be training, there's going to be device distribution, there's going to be a lot of tracking and connecting with programs and people and things like that. So obviously the very first thing we need to do is find those people. AHI has their job description. We have the position open for applications right now, and hopefully in the next couple of weeks we'll be doing some first round interviewing. So it's exciting. And then once we have that person on and they sort of understand what their job is, then we're going to really start deploying some of the financial pieces. And that is largely about milestone 2. So we are planning to purchase, and I forgot to look up the number, but in my head it's 600 to 700 Chromebooks. to between AHI and FDR-HPO. Those are going to need to be purchased and they're going to need to get deployed. So, we're going to need to get that process started, before we can do anything else. And then the other piece is really going to be to solidify and implement our strategy. So while we're in the process of getting this navigator on board, figuring out how we're going to, do some of this purchasing, we're going to be meeting with the steering committee meeting. We're going to be developing a formal roadmap, a more detailed work plan to say, we have this money, we have these milestones, we have, the strategic plan that we built. Let's put this together and make sure that we're really leveraging all of these pieces to make the most of this opportunity that we have. So that's kind of the other piece that's going to hopefully happen in the first 3 months of, at least in my head, this grant. The next piece is going to be that device distribution and literacy training. So we're still figuring out what that's going to look like. Me and the FDR-HPO team are actually starting to connect with some other digital navigator programs that are already established to figure out, we don't need to, rebuild the wheel. So to see how we can kind of do it efficiently, all these training pieces, getting Chromebooks out to people. The goal really is not to just be like, here's your Chromebook, good luck, but to say, if you attend, we'll give you this Chromebook, but you need to do, certain training with us or maybe through a service that we make available to them. So we want to make sure they know how to use the device, that they have that digital literacy and knowledge before we just send them out into the world with something that they're just going to be angry at, potentially. They're like me. Thankfully, I have an 18-year-old son, so he, solves all those problems for me. But not everyone has that resource. So that's the second milestone. The third milestone is really related to that digital literacy piece, and it's really about doing trainings and knowledge sharing related specifically to cybersecurity and privacy. Right? There's every day there's a new way that bad actors are trying to steal our money or identities or whatever else that they can get their hands on. And so that will certainly be folded into that training piece that the digital navigators are leading up. And then the last piece, the last milestone is about accessibility. And this is really about advocating for residents, for digital equity inclusion programs, kind of in the world. So we heard earlier, policy, things like that. I don't necessarily, we don't have it hasn't been built yet, but we have a strategic plan, right? And I think as part of the work plan, it's going to really be leveraging that steering committee and other coalition members that we can bring in to really try and advocate for our region when it comes to digital equity and inclusion. So, all right, so that was the 26 grant. We do have a couple of transition activities. I've referred to these already. One is this formal communication plan, which is really gonna connect, that sort of strategic plan that we built into expanding the network, into making sure that people can know that we're available as a resource, that know each other are available as a resource. So again, more to come on that. And then again, to develop a roadmap that really kind of ties both the grant and the coalition strategy together to kind of move us forward over the 18 months. I think. So we do have a email address. You can contact us here. This email comes to both Karen and I. So it's probably the best way to get a hold of us if you have, you want to collaborate, you want to be part of the network, you just have questions about how this is going to work, then that's the way. And now I don't know, Sarah, do we have a way to ask questions?
Yes, if
I can't
people can
find
feel
my
free to put it in the chat. We did have one from Morella who asked if you can share the job description. They have great graduates seeking employment, so I wrote her email address down so that
You
you
can
could
also
send
go
them.
to the AHI website, and it'll be posted there. That I think,
hihealth.org.
yeah, I was that's what I thought it
Also
was, and
said,
then I was like, is that really our website?
Yeah, it is. It
I think
is.
I would know.
Thank you, though,
I'll put
Marilla.
it on there as well. I'll
Yeah.
put it in the notes.
Yep.
Perfect. Does anybody have any questions for either Laura or Karen? I'm not as sure if I'm going to be able to let you unmute. I might have to unmute you, so if you could put it in the chat, that would be best. While I wait for that, because I'm not seeing anything pop up right now, just for a little background, so as I mentioned, I will be taking over the telehealth side of things for the North Country Telehealth Partnership with AHI. That being said, I have been with AHI for 8 years. I've worked alongside our telehealth program that entire time. So I was here when Katie Margison was anything and everything telehealth, when it went through Nancy and Jen as well. So I am new to this role, but I'm familiar with a lot of the partners and I'm familiar with the work. So if at any point in time you have any questions and I don't know the answer, I'm hoping I'll be able to pass you along to the right person, but I definitely have the right people in my corner to help me get you the information you need. The telehealth at ahihealth.org email will still work, as well as myself. You can always email me for any questions. A couple other things I want to add in. I'm looking for presenters for Telehealth Learning Collaborative. I only have so much information that I have right now given to me, so I believe we are looking for presenters for the rest of the year. You guys will see more from that as I send through emails and newsletters and such. The other thing is our 2026 North Country Leadership Summit. I'm sure all of you are familiar, but for those of you who are not familiar, that is a collaborative between AHI and the North Country Telehealth Partnership. That will take place September 30th and October 1st of this year at the Lake Placid Conference Center. Plenty of more information to come, including theme details and stuff like that, but we will be opening up the call for presenters, sponsorship, and those type of things in the coming months, so keep your eyes open for that. Other than that, I'm going to leave you guys pretty solid right now with just Laura and Karen's presentation because I have so much to learn and I don't want to bombard you guys with time that you could have back. I don't see any comments on here. I will leave it open for another minute or so, and if not, I will give you guys back another 20 minutes to shovel some snow because I'm sure we all need it. I don't know about you, but my driveway is blocked in about 5 feet with snow, so I'm sure I'm not the only one. All right, I don't see anything. Oh, Eileen said, this is really exciting. How will partners be or participants be selected?
I think that's part of what we have to figure out ourselves, quite honestly.
Yeah.
So as we talk to other digital navigator programs and figure out our roadmap, that will absolutely be one of the first things that we're gonna figure out.
Yeah, I agree. And Eileen, I think that, looking at eligibility, looking at people in our communities, I think my kind of gut feeling is we have the right resources to connect a number of people and being able to then understand where that need is greatest will be one of our first steps. So appreciate your comment on that. And I think this is exciting for the North Country. I think it's one of those where you think about people and getting them connected, and then you really don't know how to. They don't have the resources to do it. So how can we really help them?
We have another
Will
comment
you
from,
collect data after the implementation and the work that the digital navigators are doing? Satisfaction. Yep, go ahead. My internet's a little glitchy. Go ahead, Sarah.
Yeah.
Nope, I was reading your comment. I'm just going to let Laura take it if you want, or you.
Yeah, I mean, I'm a data analyst by training, so I always like to have, some data. Certainly, we live in a world where if you can't show outcomes with numbers, then they don't exist, which is unfortunate. So I'm sure that we will definitely be doing, at least some surveys of participants to, kind of that quality check as well, like what can we be doing better as we go through. It's certainly, we're not going to start off having all the answers. So if you have any experience with data collection around this kind of program, like I would love to hear from you too. Like I said, we don't need to create the wheel, and I'm relatively new to digital equity, so I would love to hear insights about what kinds of things are meaningful, especially as we start moving towards advocacy. So, what's really going to matter when we say, look, we're really making a difference in this area? How do we show that? So, the short answer, the long answer short, yes, we'll collect some data. I don't necessarily know yet what that's going to be.
Perfect answer. And then Eileen just said it'd be exciting to see if there's any connection between claims data and use of telehealth equipment. Morella also stated that I would love to help. I can reach out. I've done research on the frameworks, etc. Would love to collaborate, and we do have your email. So I will pass that along to Laura and maybe get you guys connected that way.
Perfect.
Yes. Laura's who you want in your corner with data analysis for sure. She's helped me on a lot of things. So I'm excited to see what you guys come up with from all of this. So I don't see anything else here. I'm going to let you guys have 20 minutes back in your day. Thank you so much for joining. I'm really excited to take on this work and see you guys at our next meeting in 2 months. So thank you.
Thank you, everybody.
Right.
Bye.
Bye-bye.